is the most likely diagnosis? Newborn is found to have jaundice, pallor, and hepatosplenomegaly within first 24 hours of life. Lab tests reveal hemoglobin of 12, reticulocyte count of 12%, and indirect bili of 5. Mother is blood type O, and infant is blood type A. Coombs test is positive. What is the most likely diagnosis? Okay. Coombs test positive means it has autoantibodies against itself. I believe that's right. Um, Newborn is having jaundice, pallor, hepatosplenomegaly, and then he's dealing with hemoglobin 12, reticulocyte count of 12%. I think that's a little high. I don't remember the exact values. Indirect bili of 5. Mother's blood type is what is most likely diagnosis. Dang. Okay, jaundice. Okay, picking a baby in jaundice. Indirect bili. Indirect bili is unconjugated bili, and that would be the unconjugated ones would be um, Gilbert, and then the Krigler Najar, and then um, what this is Coombs test. Coombs test is positive. So again, we're looking at like an autoimmune thing, I believe. And then mom is type O and baby's type A. It doesn't say anything about RH.
What's your gut say?
Mm, I would go. Um, I would go A. ABO, hemolytic disease of the newborn.
Good, great. So let's talk about this, right? I want you to think a little bit more clear here. You got the right answer, and I like how you're thinking, but I want it to be a little bit more clear so that you're more direct, right? I want you to
Yep.
be more confident in your answer. So newborn, jaundice, pallor, hepatosplenomegaly, not good, right? That's within the first 24 hours. Hemoglobin is 12, which is a little bit low, but not too low. Reticulocyte is 12, which is relatively high. Indirect bili is 5, which is elevated. So here's the trick. They don't give you the amount of direct. Okay, so that's the trick here. So you don't know how elevated his total bili or how elevated his direct bili is. Okay, you know that mother's blood type is type O, infant is type A. Coombs test is positive, meaning that there are antibodies that are attaching to baby's red blood cells that are killing baby's red blood cells. So likely the antibodies are from mom that passed over, passed over into baby's bloodstream and are killing baby's red blood cells. So now the question is, what is the most likely diagnosis, right? So it can't be Gilbert's because Gilbert's is usually asymptomatic and usually older people that get stressed and they turn yellow and they have increased risk. I mean, increased amount of indirect bili, but it doesn't cause them any symptoms. They just turn yellow, right? They don't have any issues. And it's usually times of stress. So running a marathon, drinking alcohol, staying up late, stressing out for step one, right, can give you a yellow tinge when you have Guber. So, but
You
nothing
said
to do.
it's more for adults, you said?
Yeah, more for adults. I would say you usually get tested for a little bit more of adult. I guess you can have it as a kid, like not as an infant. Usually don't test it in infants, but
Yeah.
usually I guess you can have it in 6 to whatever age. But usually they test you in a little bit older of a person. G6PD, right? That's going to be the oxidization and things like that, and but that's going to be kind of the Mediterranean stuff, right? Fava beans, things like that. So not G6PD. Hereditary phagocytosis, right? You're gonna see kind of these people later on can they're not usually younger, but a little bit older too. Their spleen can be enlarged because they're eating up their own red blood cells. If you do a peripheral smear, you don't see a central pallor anymore. It's all red because they're completely spherical. So not that. RH hemolytical disease of newborns. Usually newborns that have this
The
are going to
secondary.
be way sicker, right? You can have fetalis hydrops and things like that, right, with
Oh,
RH. So ABO is going to be your best answer here because mom has O, meaning that if she mixes with any A, B, or AB blood, then she's going to want to make antibodies against that. So
got it. Okay.